All right, good morning in case you're just joining us. And if you have been with us since we started the show at 6 a.m. in the morning, we appreciate your company. And we are going to be taking this now on to the second conversation that we had lined up for you. It is Wednesday, and on Wednesdays, it's usually Matters Health. And this particular morning, we want to talk about growth disorders. You know that time as a parent or a caregiver, you are observing something about your son or daughter, you feel like some things are not adding up, but you're not quite sure, or you see your son or daughter is maybe smaller than the classmates or a little bit older, looks bigger than the classmates, and you're not quite sure why this is happening, or in some cases it actually could be normal, but in certain instances there could be something that is not working out quite properly when it comes to how their bodies are generating the growth hormone and the variations. So this morning, we actually just want to simplify it and make you understand what is normal, what is not normal, and how you can be able to get help, what you need to do as a parent in case you're dealing with that, and of course, what you should do to be able to help your son or daughter. So joining me in studio this morning to have this very important conversation on the endocrine growth disorders, I'm having a panel of three. In studio with us this morning, we have Dr. Anjum Omar. She's a pediatrician, and of course has really, delved into this world of growth, and she's going to unpack, the basics that we need to understand when we want to know whether our child is growing normally or something is not quite right. And of course, we have with us Riziki Siombua, the founder of Magic Africa Foundation, and one thing about Riziki is the fact that she's very passionate about the subject we want to discuss, has got into advocacy and awareness creation on this particular subject. She'll tell us more about how she got into this particular world. And we have somebody who has worn that shoe, Priscilla Nyawira Ruara. She's a parent of a child, a daughter, a lovely girl that she's going to be telling us a bit about, and how she became concerned as a parent as to how the daughter was growing up and what they've been able to do as a family, what she has learned, some of the challenges. But karibu sana to the program, all of you. Thank you. And we'll also be joined a little later by a nurse. Her name is Catherine Koimerek. She's going to be demonstrating for us how the height is measured, and also break down for us from her line of work what they usually consider normal, what they don't consider normal, and what is the right way of actually measuring the height of a child or an adult for that matter. So let's begin straight away and begin to break this down. And I just want us, first of all, Dr. to start from a very normal perspective. Explain to us how the body works and what really usually triggers our growth. Take us inside. I know there are quite a number of terms you're going to use, but try and make us understand how it works. How is it that a few years ago I was a little baby and now I am the way I am?
Okay. Thank you so much for inviting me for such a talk. Actually, growth starts intrauterine. Mm-hmm. When the mother feels she's pregnant, that's when the growth of the baby starts. And the most important is the wellness of the mother. So it starts from conception. So how is the mother's nutrition? How is the mother gaining weight? What is she eating? So that's when the growth starts of the baby. So once the baby is born, we usually take the height and the weight of the baby, and then we start plotting. We have graphs. Mm-hmm. We start plotting on the graph that, okay, the child was born normal, even the height was normal, and then every month or 2 or 3 months, the baby comes. Actually, the baby comes for the clinic, for vaccination to the clinic. So when the baby comes for vaccination, we usually take the length of the baby. Definitely, that's a small baby. The baby cannot stand. Yeah. So we have something called infantometer. So we make the baby lie down on that infantometer and take the length of the baby. So then we plot on the graph the length. So every time the baby comes, we plot the length and the weight. How is the baby growing? So the first 3 years, nutrition is very important. Yeah. Is the child getting adequate nutrition? That is very important. And then there are other hormones which come in as well. So there's the thyroid hormone, which also helps in the growth of a child. And then after 3 years, that's when now growth hormone actively plays a role in the growth of the child. So if you see the child has been growing quite well till 2 to 3 years of age, that's when now the growth has stopped. The child is now stunted. That's when now you need to start worrying that now my child has stopped growing. So how do we know when the child stops growing? We ask the parent, like, in these 2-3 years, have you changed the size of the clothes? That is very important. Like before, maybe you were buying size 2. Have you gone to size 3? Shoes. Have you bought a bigger size in this past year? Because every year we buy bigger size. Have you bought a bigger size for the baby? They will tell you, no, we have. The size is the same because it fits, and the parents are happy because they don't have to go.
Yeah, the budget is quite friendly.
Yeah, so they don't have to go to the store each and every time to buy new clothes and new shoes. But that is a concern, actually. It is a concern, meaning that child is not growing. And the other, what we ask is, just look at your child in class. Is your child the shortest? Is your child sitting in front? Because short child cannot sit behind because they will not see. They'll not be able to see the blackboard. So is the child the shortest in your class? Then that's a concern. That is a concern. If the child is
in all circumstances,
in all circumstances.
All right.
If a child is very short in the class, all the other children are tall, but your child is very short, then that is a concern. Because sometimes that child is even bullied. The mother might not know because she is so much concerned in other things. But if the mother sees that this child is very short and other
compared
children compared to her age mates or his age mates, then that's a concern.
All right, let's talk about that concern from the perspective of somebody who has really been in that space. Priscilla, you have a daughter, and just take us through a little bit about her and what when you realized that as a parent there was something to be concerned about, and what is her case, specific case? Is she growing too fast, or was she growing too slow compared to her age mates?
Okay, thank you for having us here. So my daughter is called Kelsey. She's 8 years old currently. She was born preterm at 36 weeks. And so we were doing the follow-ups to see how the child is growing, you know, those clinic follow-ups.
The normal, just routine
checkups. You know, when a child is preterm, she has to be really checked whether she's gaining weight properly and all that. So she was not adding weight properly, because we would go back after 2 weeks and the child has just added a few grams. Being a new parent, we didn't... Us would just celebrate the child has added a few.
It was your first baby.
Yeah, a few grams. But when you compare with, she has a cousin who their age mates, their age mates, they only have like 2 weeks apart. So you'd really tell, like, this other child is so chubby, she has a nice skin and all that. So we'd feel concerned that she's not growing well. So we were being seen at MPSHA at that time. So at around 3 months, she was done some tests. She was not producing the thyroid hormone. It was insufficient. That's why she was not adding weight. So the baby could feed and enough milk. In fact, we used to top up with the formula, but the child was still not gaining. Yeah, so then after around 4 months, that's when we were sent for further tests. We were referred to the endocrine specialist at Gertrude's. They did a lot of tests, so it was found out she had multiple pituitary disorder.
Without mentioning the specific hospitals? Just run us through your journey without mentioning the places. Then she was put on the thyroid hormone to boost her metabolism, so that whatever she's eating will help her body.
And then at around 4 months, he was also put on another hormone called cortisol hormone. Then we would see now she has gained weight, the skin is looking good, she looks cute like a baby now. And then now, still at that time, the doctor said, we'll check by the time she reaches 3 years old whether she will be growing, that is height-wise. If not, then that's when we'll need to intervene and start the growth hormone. So as we were aware, at some point, we'll need the growth hormone. So she grew well, she continued adding weight, a little bit of weight, but she was still shorter than her height mates, because even in fact when she began play group, she was very small. She looked like a baby.
All right. Priscilla, let me take you just step by step before we get to her schooling and what happened after that. Before you went through this experience, had you interacted or learned or even been exposed to information about growth disorders, or was it a new experience?
It was a totally new experience. Yeah.
All right. And that is where you come in, Riziki. Yours has been more of, trying to demystify the myths and the stigma in the society about the growth disorders. I want to understand a little bit about how you came into this world and what is it that you discovered as a challenge that, we have today when it comes to even understanding these disorders and even having knowledge about it?
The challenge that I think we're having is lack of awareness. People lack awareness of these growth disorders, and also they lack the knowledge of how early intervention may play a very important role in helping the health of that child. Yes. So.
All right, so you have been doing a lot of advocacy. I want you to take me to, that particular moment or a situation that made you realize, I want to do this. This is actually important for me to get into, because you have done a lot in just creating awareness on endocrine health and just helping parents such as Priscilla. Just tell me a bit about what inspired you to get into that space.
I'm very passionate about children's growth. First of all, MAGIC stands for Major Aspect of Growth in Children. MAGIC Foundation Africa is a registered charitable organization that supports patients with endocrine conditions. And we are also an international division of MAGIC Foundation, and we're also members of ICOSEP. Basically, let me talk about ICOSEP and what we do. ICOSEP is an international coalition of organizations supporting endocrine patients. This is an umbrella of medical doctors, endocrine societies, pharmaceutical nurses, and parents who have come together to raise concerns about different endocrine conditions affecting children globally. And the reason I got inspired to even start the group, it's because of the success stories I've seen from the parents, from especially those who started their treatment, from early diagnosis of the treatment, from early diagnosis of the condition. And from the treatment, we have seen so much improvement on the child, basically on their health, and even this treatment has helped save so many children's lives.
All right. Dr. I want us to go back to where we started, because when we're talking about growth disorders, we are addressing two sides of the divide, the stunted growth and a child who is growing too fast compared to their age mates. Tell us a bit about the hormones that we are talking about and how the body works, and when is it that we can consider there is a deficiency, and when is that time where we can consider that the body is producing too much of this, and what is normal?
Okay, so there are different hormones which play in the growth of the child. So the most important first is the thyroid hormone. So this thyroid hormone, if like in our setup, we don't usually screen for thyroid deficiency. In the West and in America, they usually screen a newborn baby who is born is screened for thyroid deficiency. They just take a prick it's a heel prick, and they check. The reason being, if a child has thyroid deficiency, apart from growth, even the mental is affected. So the child is cognitively affected. So if you make the diagnosis early enough, like at 2 weeks, you can actually prevent that child to be intellectual disabled. The child can just grow normally, but early diagnosis is very important. And then, so thyroid, and it also affects the growth. So if you have thyroid deficiency, you will be stunted, you will not grow. The other hormone which is very important is cortisol. Okay, so if a child, as Priscilla, one of our parents, has mentioned, if a child is not growing, then we also look for the hormone called cortisol, because cortisol, what happens is very important in the function of our body. So if a child is cortisol deficiency and the child gets sick, can die of that hormone of cortisol deficiency. That's why it's very important. And this cortisol is also important in growth, not directly but indirectly.
All right.
And then growth hormone. So growth hormone, what happens is if a child is deficient in growth hormone, the body will not grow. So it's not just the body, it's also the organs of the body will not grow. So the organs also remain small. And that's why mortality, the death, comes earlier. The person can get a cardiac, like an MI or all that at a very early age. So that's why growth hormone is very important, apart from the physical growth, the growth of the organs.
All right.
Yeah.
Let's talk about how this affects younger children and adults. Does it work the same? Because is there a possibility that I could grow normally and get to a point where I experience a growth disorder? And
yes, actually it happens.
Yeah.
So we have some patients who have been growing quite well, then at 5 years or 6 years, they stop growing.
Yeah.
What could be the reason? That is not that is growth hormone deficiency, but how did it happen?
Yeah.
So maybe that is now what we call it, it has happened later in life. So what could have happened? An infection. Maybe the child got an infection in the brain or a tumor in the brain, okay, which now has halted that growth. Or it just could have been something which has just stopped functioning. We call it idiopathic. There is we have looked for everything, we have done an MRI, everything, but we can't see anything. So the child has just stopped growing. So that is the other reason, the second reason, apart from the birth, the reason during birth. So this is the other reason. So that's why history is very important. We ask, has the child been gone through radiation? That's why radiation is very important, because radiation to the brain can even affect that pituitary gland, and that pituitary is a very small gland in the brain which produces all those hormones, and which are very important in life. It's just it's like it's even smaller than a pea. Imagine. Yeah.
All right, and I'd like to know more about even how you make the diagnosis and how you get to identify what specific cause could be for this particular disorder that you're addressing. But before that, Priscilla, just take me through the world around you, because we live in a world where, like Riziki was saying, there's still a lot of lack of information around growth disorders. So you're also new to this world. So your child is having that particular challenge, and it has gotten to that age where now you have to expose your daughter to the outside world. How was that like for you as a parent?
It's quite challenging. Like for instance, you're going to work, so you have to employ a house help. You have to show them how to take care of the kid. Like the way Dr. said, when a child has the deficiency of cortisol hormone, when they get an illness, let's say a fever, they can get seizures or convulsions. So you want someone the nanny who is taking the care of that child has to, at least, you also as a parent has to be very keen. If the child has a fever, I have to make sure I give double dose of the cortisol, and then I have to really take good care of the child. If the child doesn't have appetite, you make sure at least to give her something small so that she doesn't maybe sleep hungry because she doesn't feel like eating and then wake up with a seizure. Then you get there some nannies. Sometimes you can get one who is not so good, and then they are calling your child kafupi.
They're insensitive
They are very
to
insensitive.
what is happening.
Yes. Then when it comes to the children interacting, they'll just think this is the baby is smaller than the others. So like for Kelsey, she just used to be carried by the other ones. In fact, even the teacher is telling her, no, don't carry her. She's your age mate. Don't carry her. Don't treat her so much like a baby. For her, she was just enjoying the attention. Yeah.
But did it affect her, like psychologically, like those nicknames she was being given, the treatment she was being given among her mates? Did she share such experiences with you?
Sometimes she will ask me why she's short. Myself, I'm not so tall, so I'll tell her, even me, I'm not so tall. Yeah, but now that she has grown a little bit bigger, now like we have started explaining to her like why she has to, like now because she's on the growth hormone, it's an injection that we give daily. So like you have to explain now why are we giving you the injection? Yeah. And
what about yourself as a parent? You're saying you even had a close relative who was the same age as your daughter. I'm sure you were interacting with other women, you're going to clinic. Did you have any concerns about what society, how it was reacting to the growth levels of your daughter?
I would say my family has been very supportive.
Yeah.
Like the way I was saying, the close relative, this is my brother's child. I remember there was a time we had gone to visit them, and then we had an appointment on like a Thursday, and we had gone on a Tuesday. So at that time, the child had a bit of jaundice, and then she was also very small. And so my brother, because for him that was his second born, he had some experience in parenting. He was like, no, I have to take you to hospital myself. Like I'm telling him, I have an appointment on Thursday, but he wants to be there and confirm that really what is happening. Why is this child having jaundice at this time? Like even if the appointment was for Thursday, let's even go early and let's understand.
So you had that support system that really helped, Riziki, what do you think though, because you work with a network of parents,
Yes.
For her, she's lucky she was from a side where she got that support, but have you encountered instances where society doesn't react in the best way to such cases, where there's a lot of stigma, or even the parents themselves even feeling a bit off about their daughter or son, and even just not doing anything about it?
Yes, there's a stigma. One, because people are not aware of the different endocrine conditions. The conditions could be, like the doctor said, there are other factors that may cause the child to be different than the rest. It just needs people to understand that these conditions have been there, because 4 out of 10 children born, they have these rare diseases like growth deficiency. So it's all about awareness, knowing that these conditions are there, and then just accepting people for who they are and how they are.
What are some of the unfortunate testimonials that parents have shared with you with regards to their journey of just raising a child with a growth disorder?
Their journey is the cost. The cost of this treatment. Now the child has been diagnosed with this condition. What is the next step? The treatment itself is very expensive. Like a pen goes it used to be 9,000, now it's around 35 to 40,000. Besides that, it's not covered by the health insurance. You find that countries in the West and European countries, these conditions are covered by the health insurance. So if they could be covered, because you find some conditions are very severe. They can't actually survive without the growth hormone. So there's the need for also the government to intervene when it comes to be covered by the health insurance. Yes.
All right. We'll talk more about the treatment, because at least there is hope that there's something that a parent or a caregiver can be able to do. And I like that about this conversation, that she's even saying the daughter is under some sort of treatment, and you're also saying that despite the fact that it costs a lot, but at least we have a breakthrough in that aspect. But Dr., before we get to the treatment, how do you diagnose and how do you get to identify the specific issue that is there? Because not every patient presents with the same type of a disorder. So what do you use?
Yeah, it's the parents' concern. So when they come, they're like, you know what, my child is short. So you will see a very short child, but he's a very talkative child. In fact, you're like, oh, how come this child is talking? You know, he looks like a 2-year-old. We had a patient like that, like looks like a 2-year, but when the child came was talking. So we were shocked. And then when they came, we take the history. They're like, the father is like, no, this child is 5 years, it's not 2. So then that's when now you take the height and the weight, and then you plot on the chart. And then once now you have made that, now you have seen that the child is short, he's even below the 3rd centile. He's way below the 3rd centile. And so then what we do is now we start doing the tests to check, okay, what is wrong with the child. Okay, so then the first step is first we need to rule out any chronic illnesses. As I said, not only growth hormone deficiency,
even the other factors.
Even kidney disease, chronic kidney disease, heart disease, heart failure. You know, very many people nowadays, children are being born with heart defects. Even that can give you growth failure. So first we have to rule that out. Does the child have any other chronic illness? So, and then after we have ruled out that, then we check for the hormones. So the first hormone we check is the thyroid. How is the thyroid? Because that's the easiest to treat. And then how is the cortisol? The second easiest to treat. And then now we do the growth hormone. We check for the growth hormone. So what we do is, it's the endocrinologists who actually do the test. We do the growth hormone stimulation test. So we stimulate the brain to see if there is growth hormone, the secretion of growth hormone from the brain. And that takes, like, the child has to be not admitted, but in the hospital or in the clinic for an hour or 2. And we give a particular medicine for that to the child, and every half an hour we draw blood to check for the growth hormones. And then now we check for the levels of growth hormone, because we have to have a peak of at least 10, one peak. So if we don't have any peak, that means this child is growth hormone deficient. Yeah, that's when now we start the treatment.
All right. Do you have instances where it's growth that is too fast?
Yes, so we have, it's called acromegaly or gigantism, that the child is really growing very fast, and that's also a concern. So that is also a concern, like the child is growing way, you see, we have every year, the child has to grow between 4 to 6 centimeters. So if the child is growing like 10, 12 centimeters, that's a concern. So there is also treatment to slow down. We first of all, we find the cause of that, and then we start treatment to slow down the growth.
Just on a light note, there are parents who have adolescents who are taller than them. Should they be concerned?
No. You see, that one is if they are, you see, acromegaly is different. Like, it's not just tall. It's like the hands are coarse, you know, the face is coarse. So there are certain features which we see and we say, no, this is not normal. Because the tallness could just be from the family. You know, maybe one of the family members is very tall and that child has taken up from that member.
One of these days we should talk about acromegaly and gigantism, just to also look at how this affects the adults. But let me come back to you, Priscilla. You have been on a journey just to try and help your daughter. Are you seeing progress, and what is it that you're noticing, and are things getting better in terms of her graph in growth?
Yeah, we began the growth hormone at around 3 years. She's now 8 years. We have seen a lot of improvement. However, what has been really a challenge is the aspect of costs, because like Siombua said, this is not covered by insurance. Even if you have an insurance cover, it won't cover. So you have to really look for money.
Out of pocket.
out of pocket,
Yeah.
if it means borrowing, asking friends to support you, doing fundraising and such. So it has really been draining financially, but we are happy to see that there's progress. Yeah, like when we began treatment, she had a babyish face, but now you can see she's a bit smaller for her age, but she's okay. She plays normally, she goes to school normally, she's doing well in school, and so we are happy for the progress. Yeah.
Okay, there is hope. Riziki, what sort of support do parents such as Priscilla need? And if you look at our country right now, do you think we have done enough to really address these types of conditions, or it's still a quiet subject that lacks policy, lacks investment, lacks? Talk to us about that space. How are we doing?
We're not doing so well.
Yeah?
Because we find that so many children have this condition, but in order to start the treatment, there are costs. Like the doctor said, you find the younger one may use like just 1 pen or 2 in a month. Like I said, it's from 35 to 40,000. As they grow older now in the adolescent age, they may use up to 10 or more. So you do them as it's expensive. Now, when you start on the treatment, there needs to be consistency. Once you see there is progress with the growth of a child, that consistency is lacking. That's why I'm saying we need support from the government to see how important the growth hormone is. We are only aware of insulin, how it plays an important role to patients with diabetes. What about those children who have deficiency? They also need the growth hormone. It should equally be important. Yes.
Do you have like parents dropping off from the treatment?
Yes, yes, because actually from 2022, during the COVID pandemics, there were shortages. Parents had to outsource from other countries. And even now, it's still a challenge because it's too expensive. So those are the challenges, too expensive and also not covered by the health insurance. Yes.
Doctor, do you have to like stay, is it like a lifetime? Do the person in question, they have to stay on the the treatment for their entire life, or does it get to a particular point where they can be left to grow normally?
Okay, if the child is complete deficient, like if the child does not have any growth hormone in the body, then that child has to be on growth hormone for life. But the good thing is, as they become adults, now we are not very much keen on their growth, but we need their organs to grow and to sustain. So we put them on a very low dose because it also produces muscles and all that. So we put them on a very low dose daily to sustain life. Yeah, so they have to be on growth hormone, ideally for life. But we see after they have gotten that, attained the height, they usually drop off because now they are not too much keen. They think growth hormone is just for physical growth, but it's also growth of the organs as well. Yeah.
Just to add on what she had, shared with us in terms of her own experience, nutrition, the care that is needed, and what she's doing as a parent. Just also to add more on to that, a child who is having this particular kind of a disorder, what are some of the most important things that parents or caregivers should be able to do and ensure so that the treatment actually works and supports that particular journey in a positive way?
Yeah, so they should not miss the injection. Okay, for sometimes the small children, they might miss for some days. That is not a problem, but they should not miss for a very long period of time, like months, because that's now the growth stops. And then nutrition is also important, definitely. The child has to be on a balanced diet, proper nutrition. Yeah, and then these children, they have, psychosocial is also very important in growth of a child as well. So we actually look at the psychosocial of the child, like how is the child treated. They usually face a lot of stigma that you are short, you can't play, you can't be part of us, because you will now, when we play, you will whatever us our team will lose because of height, you know, so games like volleyball and, you know, where then you need height. So that's where the challenges are. And the other thing I want to say is growth hormone is not only for growth hormone deficiency. As I said, even chronic kidney disease patients, if their growth is stunted, they need it. They need growth hormone. So growth hormone is actually for many other causes, like even other chronic illnesses, like, and the child is having other chronic illness and is not growing, but that illness is taken care of. But it's just now the growth. So that growth can actually be augmented by growth hormone. Yeah.
True. And I like the awareness we're creating on this platform. And Siombo, I want you to talk to a parent who could be watching this morning, or a caregiver who is interacting with this information for the very first time. And even those who have sort of like noticed there is something about the growth of their child, but they're not doing anything about it, or they're not quite sure what they need to do.
Okay, can the camera see this?
Yeah.
So to any new parents, I believe they are given this book on how to be monitoring their children's growth. So we have a graph for boys and girls, and parents can monitor this. If a child is way below the dotted line, those are points of concerns. You should start investigating more and even visit institutions that may help you understand why your child is not growing well. Yes.
All right. And I just want us to also talk about something that I came across when I was just prepping for this show, Daktari. The MRI, the CT scans, at what point is this done? Is it necessary? And what principles do you use to ensure that that is also the direction of diagnosis that you want to take?
Yeah, it is necessary. Once we have seen the hormones, like let's say we have checked for thyroid hormone, cortisol, growth, all are deficient. So we need to know the cause of that. So one of the thing we do is an MRI of the brain and the pituitary, because as I mentioned, it's the pituitary which secretes this hormones. So we need to see, is there a pituitary there, or sometimes there might be no pituitary, because there is a place, it's called sella turcica. The pituitary is placed in that. So sometimes this pituitary is not there, it's just an empty sella, so there is no pituitary. Yeah, or the stalk, there is a problem with the stalk. The stalk is
so you can lack that gland.
You can lack that gland, and you can see it in the MRI. Okay. Not the CT, but MRI of the brain and the pituitary. So that's why we make the diagnosis. Yeah.
All right. Looks like it's something that we really need to create more awareness about, and people just need to understand how all this goes, because we have those concerns among parents. You see your son is either too grown, or their growth is stunted, if you look at the age mates around. And just to help these children to avoid the unnecessary stigma, and also you hear the options of how you can be able to help your son or daughter get treatment, then just choose to take that active, step and go to the health facility and seek help to just know what you can be able to do going forward. I'm just about to be joined by Catherine Koimerek, a nurse, who will be demonstrating for us an equipment that is actually used to measure the height of children, and I believe also adults, and how the best way to do it, because there is a way you can do it the wrong way. So how it is done the right way, what this means, what this doesn't mean, and how they take those measurements. But as we go to that particular segment, I'd just like to hear from you, Priscilla. Tell me a bit more about your family now. Is that the only child you have, or you have others, and how are they?
So now I have another girl. I have a second daughter. She's 2 years old. And now comparing the growths of the two, I can really see that there was really a need to intervene for the firstborn, because it is very clear that she was not growing properly the way she was supposed to be growing. Like some of the shoes she used to wear, the secondborn didn't even wear because they were too small. So, and then, yeah, and also getting a sibling for her has been good for her, because now it also motivates her to maybe feed well. You know, some children are usually picky eaters. So now at least having a sibling is good for her. Yeah.
All right. So I want us to we've crossed over to this other side. I'm assuming we are at a health facility, and we have a little demonstration that we want to show you. First of all, thank you for creating time for us. Karibu sana to the show, Catherine. Yeah, so Catherine is our nurse for today, and we have Jackie? Jane is going to be helping us to just demonstrate how this works. So over to you. Just tell us a bit about what this is and how you do what you do at the health facility.
Thank you so much for having us this morning. As you can see, this is a stadiometer. It is used to check on the height of children who are above 2 years. And for those who are less than 2 years, then we use an infantometer where we light on the table, and we are able to take the length for the children.
All right.
And then we are having this stadiometer now for the children who are above 2 years. And when you're having it, make sure that it is stable, a place that it is not shaking. So make sure that the ground is really stable. Then you can have your patient, make sure that they can stand, not anybody who is wobbly. So for the small children, you can have at least an assistant. The mother can help you to make sure that the child is stable so that you are able to have the height done well. And for the ones that can stand, then you can always ask them to stand at the stadiometer. So we're having Joy this morning. Thank you, Joy. Jane, you can remove your shoes.
So we are assuming she's our child for today.
Yes. So good morning, Jane. We're going to take your height this morning just to see how you are doing. Okay. So I want you to look forward. Don't raise your arm. Yes. Then you can move your legs behind. Yes. Then you stand straight. Then you're going to use this board to make sure that we are going to have it go all the way down. And for anyone who has those, the hair,
the fancy
styles, yes, we'll need to remove them just to see that and make sure that we are having the right height. So for Jen this morning, she has pretty nice braids, so we're good to go. So we will make sure that it is pretty leaning on the board, and make sure that she is looking straight. Then we'll have her height taken. She's 157.5 centimeters, and we'll make sure that we have recorded it immediately so that we don't forget. Again, remember, for the small children, you'll make sure that it's okay. You are having a parent assist you so that if they are not able to stand straight, we are able to make sure that the child has stand straight. Okay? And the legs should be pretty back, and make sure that they are at the board. It's really an uncomfortable thing, so you need to make sure that you are doing it pretty fast.
All right. Okay. So maybe what's the importance of looking straight ahead? And also, I saw she removed, she removed her shoes. I believe that is not just a coincidence. There's a reason. So take us through why that is important.
Okay, we need to remove the shoes because, again, remember, if you're having a heeled shoe in any size, then it's going to interfere or it's going to tamper with the height. So she needs to remove her shoes, and if her socks are also those fluffy ones, she'll also need to remove them. For her, she has pretty socks that are not very fluffy, so she's good to go. So anytime you're taking the height, make sure that the child or the patient does not have any shoes with them.
All right.
And then she needs to look straight. Where we're looking straight is to make sure that for sure we are getting the right height. You see, if on the same direction, so you need to make sure that you are having it done straight. So for those who are not able to hold their neck properly, then you can have it like that, and then someone else assists you to yes. Again, for the small children, you can use your between your thumb and your first finger just to make sure that they are looking straight.
Okay. And some of them cannot relax during this session, so it's not a very easy one.
Yes.
She makes it look so easy right here in studio, but at the health facility, this is quite a tricky one, especially working with the children. But then why is it important that she has to lean directly on
the board,
so that
again,
you don't have space in between, yeah?
And again, that is to make sure that you are having the right height. You see, if you are bending it like this, you'll not be able to take it really, really straight on, or rather, you'll not be able to get the right height. So you need, again, to make sure that they are leaning towards the board. to make sure that you are having the ideal and the correct heights.
All right. Thank you so much, Catherine and Jane, for being our patient today, our child today. Thank you so much. And of course, that is how we wrap this up. We really appreciate your time for this particular program. Of course, we will revisit this particular discussion on another segment. We've run out of time, unfortunately, but I'm sure you've learned a thing or two on how this works and the significance of you as a parent to just play that active role of ensuring that you're monitoring the progress of the growth of your child and to take the necessary action in case something is not normal about it. My name is Safina Chengo Oma. Thank you so much for watching this show. Have a lovely day ahead.